You've probably heard of endometriosis affecting the ovaries or uterus, but what if I told you it can also grow on your bowel, bladder, and even your diaphragm? These are some of the most commonly missed sites of disease, yet they can cause some of the most debilitating symptoms. And the scary part, many people live for years without knowing this is the root cause of their pain. Hi, I'm Dr. Abhishek Mangeshikar, robotic excision surgeon and endometriosis specialist. In this video, we'll talk about how endometriosis affects these three critical areas, the symptoms you should never ignore, how to get the right diagnosis, and what treatment options can actually make a difference. By the end of this, you'll fully understand why painful periods are only the tip of the iceberg when it comes to endometriosis. When endometriosis infiltrates the bowel wall, we call it bowel endometriosis, usually affecting the rectum or sigmoid colon, but sometimes higher up even in the appendix and the small intestine. Typical symptoms include severe pain during bowel movements, especially during your period, constipation that can worsen cyclically, diarrhea or alternating bowel habits, bloating so severe it's often called endobelly. In advanced cases, blood in the stool during periods. These symptoms are often misdiagnosed as IBS for years. The key difference is that bowel endometriosis is hormonally driven, meaning symptoms flare in relation to your cycle. If untreated, large nodules can narrow the bowel and cause partial or complete obstruction. Bladder endometriosis can grow on the outside of the bladder or the peritoneal surface or infiltrate into the bladder wall. The key symptoms to watch out for: pain or burning sensation when urinating during your period, frequent urge to urinate, blood in the urine during menstruation, suprapubic pain, which is a dull ache in the lower abdomen that worsens with a full bladder. Like bowel disease, bladder endo is often misdiagnosed, this time as recurrent UTIs or interstitial cystitis. The difference? Bladder endo symptoms have a clear connection to your cycle. One of my own hospital nurses, where I head the department for endometriosis, was misdiagnosed for years. She had even undergone a hysterectomy many years ago, but her pain persisted. She had seen several gynecologists and urologists, but nobody put the pieces together. When she finally reached out, I reviewed the MRI and immediately spotted a large bladder nodule that had been left behind. The gynecologist treated the uterus, the urologist looked inside the bladder, but neither considered endometriosis as the unifying diagnosis. All it required was looking a little deeper. If left untreated, bladder endometriosis can invade the bladder muscle, and in some cases, partial bladder resection may be needed during surgery. Yes, endometriosis can grow on your diaphragm, the muscle that separates the chest cavity from the abdominal cavity. This is called diaphragmatic endometriosis and is part of thoracic endometriosis. Classic symptoms include right-sided shoulder pain during your period, pain often under your ribs mistaken for gallbladder issues, pain that worsens when breathing deeply or coughing. In severe cases, recurrent lung collapse known as catamenial pneumothorax. Of course, if it's on the left side of the diaphragm, it will cause symptoms on the left shoulder or under the left rib. Because the diaphragm is so far from the pelvis, this form of endo is frequently missed unless your surgeon knows to look for it. In my practice, we actively inspect the diaphragm during surgery by mobilizing and pushing down upon the liver so we can see the upper surface of the diaphragm and lift the liver and look behind the gallbladder for the posterior diaphragm. Why these sites are often missed? Because symptoms can mimic other diseases such as IBS, UTIs, gallbladder disease, and even nerve pain. Imaging is not always reliable. Standard scans don't focus on these areas. Surgeons may not inspect them during surgery, especially if they're not specialized in endometriosis advanced excision. And very often, each specialist only looks at their own organ. Gynecologists focus on the uterus, urologists on the bladder, gastroenterologists on the bowel. Without an endometriosis specialist tying it all together, disease often gets missed. If you suspect endometriosis in these areas, expert imaging and evaluation are critical. For bowel, MRI with bowel protocol or high-resolution transvaginal ultrasound with bowel mapping. For the bladder, MRI with attention to the bladder wall and a TVS, which is a transvaginal ultrasound, can also pick this up very well. Always scan the ureter and kidneys too, since bladder endometriosis can cause silent obstruction. For the diaphragm, MRI with coverage of the upper abdomen, a CT chest and abdomen if symptoms are severe or there's suspicion of thoracic involvement. But remember, imaging is only part of the puzzle. A specialist who regularly treats deep endometriosis must correlate your symptoms, exam findings, and imaging before making a plan. Medical suppression can ease symptoms temporarily, but it cannot remove endometriotic lesions from the bowel, bladder, or diaphragm. The gold standard is complete excision surgery, ideally performed by a multidisciplinary team. which is a gynecological excision surgeon, colorectal surgeon for bowel disease, a urologist for bladder disease, thoracic surgeon for diaphragm and lung disease. The surgical goal should be to remove all visible disease, restore normal function of affected organs, preserve as much healthy tissue as possible. When done properly, excision offers long-term relief and dramatically lowers recurrence rates. If you have cyclical bowel symptoms, bladder pain, or shoulder or rib pain, don't ignore it. These are not just part of having periods. They may be signs of deep infiltrating endometriosis in organs that most doctors don't even consider. Share this video with someone who's been told their symptoms are IBS, UTIs, or just stress. The right information could save them years of pain and misdiagnosis. And if you find this helpful, like, share, and subscribe so we can keep spreading evidence-based, life-changing information about endometriosis.